Hello, I'm Craig Stern of Pharma Pharmaceutical Consultants. We started to talk in the last time about rebates, and I'd like to carry on the discussion. There's a very big subject, and we could spend a long time about it. I've written several articles about it, and it takes a long time, but let me see if we can take this further. We talked last time about rebates as being like volume discounting, where drug manufacturers are offering rebates in order to lower the cost of goods sold for purchasers, payers, whether they were health plans or self-insured employers or whomever. And there's been a significant amount of controversy. Some of those purchasers look at rebates as something that they really want to get in order to lower their cost. Many of them look at it as a way to offset their administrative fees that they may be paying health plans or pharmacy benefit managers. Others of them look at it and say, I don't care. The rebates don't necessarily get me in the black. Whatever I get, but other than that, I don't care. So there's a lot of different versions and options that people tend to look at. The real question has been not so much about the rebate and how much it is. Arguments have really gone around how much rebates are actually being paid, how much are being collected by the purchaser, the people who really pay the bills. And the issue of PBMs, perhaps health plans, in trying to keep information secret as to how much is really collected, how much is given, etc. At the end of the day, the individual who is adjudicating the claim or paying the claim and then is submitting that information to a manufacturer acts as a business representative, effectively as an accounts receivable collector. So the finance people look at this and say, okay, what is my total opportunity in rebates? How much am I collecting? And then when I look at that, how good is a PBM or a health plan or otherwise in making those collections and helping me to get more rebates? Some of the CFOs will look at this and say, well, this is really a cash flow issue, and I need to know how much rebate did I collect for every drug that I paid for? How much was submitted to the manufacturer? How much did the manufacturer pay for that? And then how much was I paid for it? It's a cash flow issue. I've written about that and certainly talked about how do you follow that cash flow and how do you measure it to ensure what your overall efficiency of payment is. And others have looked at it and said, well, a PBM, for example, or a plan may pay based on their book of business. So they put all the money to the manufacturer. The manufacturer sends the rebate remittance to them, and then they divide it up in a percentage based on how much percentage of the total PBM or health plan business is for that particular purchaser. However it's done, the bottom line here is that contracts that purchasers sign with their providers, health plans and PBMs, etc., have to decide how they want it to be collected, how important it is to them, what they want in the contract, how they're going to collect it, and effectively how are they going to measure that. In most cases, they don't even know how to measure it. They just get a rebate check, they put it into general fund, and in so doing, they don't have a real cash flow model in order to deal with that. I would suggest to you that over time, as more and more of the operations of purchasers, especially the federal government getting involved, and the federal government wants these rebates to be addressed at point of sale, more and more of this will be audited, more and more of it will be a clear audit trail, and areas where it is not a clear audit trail, meaning that the payment is either tied to the individual drug or NDC that was dispensed, and whatever fees are collected separate from those, all of that will be looked at more carefully. And as I mentioned before, transparency, transparency, transparency will be the main issue. Transparency is, of course, the new code word for secrecy, and with the federal government involved, with the secrecy veil will be lifted and people will begin to look more carefully. There's a lot more to talk about in this subject. In future talks, we'll try and address some of those. I wish you all a very good day and look forward to speaking to you again.